Hi, I'm Paul Dhanuka. I'm a local physician.
I am Arthur Gorman. I'm a nurse here in town.
And my name is James Moo, and I'm a local primary care doctor, family doctor to be more exact.
My name is Dr. Doug McConnell. I served in Redding, California as a cardiovascular surgeon, as chief of that service at Shasta Regional.
And why don't you introduce yourself?
Oh, hi. I'm Richard Malotky. I'm a family doctor here in Redding.
Thank you. Thank you for joining us. And Dr. McConnell, you had a comment?
And let me just say, he's not just a family doctor. He's a great family doctor in Reading who's been around for a long time.
Well, that's
and a good friend.
So the question is, why do we need to mandate vaccinating to those low-risk population?
That's our next question. Yeah, question 4. Are school children ages 0 to 17 in need of COVID vaccination? That's the kind of the elephant in the room in our country right now, because all these mandates. I'm a high school teacher, and I believe Newsom said that as soon as it's approved for ages 12 and up, children in California must take the COVID vaccine or be on distance learning or homeschool. So you can't come to school as a child 12 and up, probably January, February.
right.
And when it's approved ages 5 and up, it's going to be the same mandate, he said.
And that mandate is already enforced in the city of San Francisco.
Okay.
That
If
is
you're
correct.
over 5, you have to have a vaccine card to go in a restaurant.
So is that logical? Do we need to vaccinate children 0 to 17?
No.
Yeah, I would say absolutely not. Yeah, go ahead, Doug.
There's the numbers that are reported by the CDC itself does not indicate any sort of medical emergency in that age class. There are children with comorbidities selectively should be vaccinated, which is very clear and has always been the case, but the widespread total population vaccination, each patient should be treated as the risk-benefit ratio, ethically, medically. And if you can't see that the unknown risks, when you have virtually no medical benefit to the people you're administering, it's unethical to give it. But I don't know where Gavin Newsom's getting his medical training or his advice, but there's an issue of ethicity and morality in basically subjecting children who we know now well into this pandemic have this limited morbidity and mortality from this particular disease. One can speculate about variants. Not being a pediatrician, I won't try, but based on numbers we know, I think it's probably highly controversial to proceed. It's up to the government to it's up to NIH to actually make the case if they're going to create use of an emergency utilization, define the emergency in plain language so that the parents and people of the United States understand exactly why this age group is in a medical emergency. If you cannot define that, then don't create a mandate.
Well, if you look at this scientifically or medically, there are 2 reasons why you want to mandate a vaccine. Number one is to protect the individual at risk, and the second reason is to stop the spread of the disease. Now, we know that the children, especially under 18, they are at very low risk of dying from this disease. The number since the beginning of the pandemic, and we're into 19, 20 months now, we have anywhere from 500 to less than 800 deaths occurring in this group, and majority of those unfortunate children have underlying medical conditions. So, to mandate the vaccine to everyone, including healthy, let alone naturally immunized children, it does not make sense from that standpoint. Now, number 2 is the transmission of the virus. And as we know that this crop of vaccine does not stop the transmission. So that argument is also out the door. So we end up leaving no reason, no good, logical, scientific, medical reason to mandate vaccine in this age group.
Can one of you, maybe explain what is the VAERS database and how do we input information into that? Can any just random person put in information in the VAERS database? How does that process work?
You could go online and after about 15 or 20 minutes find your way to the reporting section on the VAERS reporting.
What is VAERS?
So VAERS is where you would report a side effect if you were going to have that from the vaccine, whether it's a mild side effect like a headache or runny nose all the way to death. But in healthcare, even as a nurse, they haven't ever trained us to report anything in the VAERS database. So if someone came to me and said, oh, I have this side effect, I really wouldn't know what to do with it unless I studied on my own and found a way to put it in the VAERS. And then once you get there, if you put it in incorrectly, then you could be in trouble with the federal government.
Okay, so this database, it's been around since 1990, right?
Right.
And is it controlled by the FDA or CDC?
That's a good question.
One of those two organizations, right?
Right.
So they're collecting this data. And have any of you doctors ever inputted information into the VAERS database?
I haven't. I've had two patients have pretty bad reactions from their vaccine, and they both were reported by. I contacted our public health department, and they were reported by that.
So the public health department put it into the VAERS database?
Correct.
Okay. Is that the typical avenue?
None of this is typical for me,
Okay.
so I don't normally report anything to the public health department. But both of the patients I'm thinking of already had immunity. I diagnosed them in my parking lot. I showed them their antibodies. I told them not to get the vaccine. And now one of them, who was my friend, is dead. And one was 4 days in Mercy Hospital, paralyzed with Guillain-Barré. And none of that's okay with me. Mostly that's why I'm here today.
Personally, I have never reported to VAERS. That's why a lot of people think side effect for vaccine, any vaccine, is underreported through this system because it's just kind of cumbersome to report it.
You would think if this is the only data collection system for vaccines, you would think
in the United States.
In the United States, that healthcare professionals would be well trained on it and know how to use it. Just because, I mean, I've heard that as American citizens, we are innocent until proven guilty, right? But as far as medicine goes, new medicine is guilty until proven innocent, right?
Correct.
New medicine is questioned and inspected and analyzed, and we don't approve it until we know it's safe and effective, right? That's
and even after the approval, we discover the more problems in a post-marketing experience, and then it gets sued and pulled back. Zantac is a great example. That medicine has been around for 20 years and recently was pulled off the market because of the fear of frivolous lawsuits. I think it was a great medicine. It should not have been pulled. However, it was pulled. And this happens all the time.
But we're not even collecting data accurately using this system for this vaccine, right? And so I read some study somewhere that they estimate only 1% of actual adverse reactions are reported to VAERS. So the real number could be much higher than what's actually reported.
I don't have a proof one way or other.
Okay.
I don't know the percentage, but I know it's underreported.
It's definitely underreported.
Now, this vaccine could be different because it's brand new, new technology, and maybe we are more aware of it. But I know in the previous vaccines were underreported in terms of side effects.
And there has been a history of vaccines pulled from the market due to adverse events. I think swine flu was an example of that, wasn't it, in the mid-'70s?
I'm not sure.
Oh, the H1N1 was 5 or 6 years ago.
But I don't know about the vaccine.
Oh, the vaccine.
I don't know about that.
Well, right here we're looking at a graph, question 7 of VAERS data. This is from OpenVAERS. All U.S. deaths reported to VAERS by year, starting in 1990 all the way to 2021, and it looks like on the graph the average of associated deaths, right? Correlation, not necessarily cause, but it might be. Per year is maybe 400 or 500 reported to VAERS, and then in 2021, the VAERS system jumped up to over 8,000 deaths